I am Assistant Professor J. Hasul, RPH, CPS, and MSc. After watching the video, the viewer should be able to describe the effect of pediatric tuberculosis within the household, explain the importance of Information Education Campaign or IEC materials, and to enumerate practical examples of IEC to be implemented within the community. Pandemic struck our usual daily normal living. We are still experiencing its impact on healthcare and economy. With the current surge and the developing variants that hit within the community, we cannot exactly tell when this will end. Initially, strict implementation of minimum health standards such as wearing face mask, face shield, and other social distancing were in effect. Vaccine development was underway for our protection. However, it is obvious that number of cases still increase every day. Before the pandemic, we still have existing transmission of airborne disease such as tuberculosis. Tuberculosis was already eradicated in different parts of the world due to the emergence of effective drug treatment and immunization program. But how come our country still coping to the burden of this disease? Are we capable enough to handle this situation? Can we still surpass the challenges in COVID-19 pandemic? The answer might start in our own household through effective disease information and communication. Good day. I am Assistant Professor J. Hazul, pharmacist by profession, social health researcher, and faculty from the University of Santo Tomas. It is my pleasure to share with you about the practical strategy to implement the dissemination of information on disease such as tuberculosis. The focus of discussion is devoted to the pediatric tuberculosis. At the end of this presentation, you will learn on the effect of the pediatric tuberculosis within the household, the importance of Information Education Campaign or IEC materials, and the practical examples of IEC to be implemented within the community. I would like to acknowledge Associate Professor Maria Carins Alejandria, PhD, of the UST Research Center for the Social Sciences and Education, Mr. Solomon Sarne, a freelance researcher focused on geography and economic topics, and a development economics graduate student at the School of Economics, University of the Philippines, Diliman, and Ms. Laura Kimberly Cabalbag of the UST Graduate School for helping and assisting me in this project. Please take note that the research activities were conducted prior to the COVID-19 pandemic. Tuberculosis is a top 10 cause of death among children worldwide. According to the WHO, there is an estimation of about 10,600 patients with multi-drug resistant TB or the MDR-TB in 2011, which could be a reason for the socioeconomic cost to the country. Treatment of TB among pediatric population is often challenging. Lack of information on drug formulation and medication adherence are some of the concern in its management. TB is coined as the disease of poverty since poor people tend to live in an overpopulated, poor ventilation, and cramped places. Contact with an individual with an infectious tuberculosis cases may happen due to the crowding in space. Thus, the prevalence of tuberculosis can be decreased through socioeconomic development, which would subsequently lead to reducing the crowding population in urban communities, as well as improving the nutritional intake of children. Higher TB incidents were recorded in places with higher population density. TB bacteria stays in rooms with no fresh air or no air circulation, therefore increasing the risk of TB transmission. The transmission of tuberculosis to a household or community setting is a more rampant factor, especially in patients positive in different tests. Smoking also increases the risk of acquiring TB. Children exposed to secondhand smoking is a contributory factor. Air pollution is also a risk factor since it can weaken the lungs and increase the risk of obtaining TB. Poor working environment increase the transmission of infection. Tuberculosis can be transmitted more outside the household, such as the schools, public transportations, workplaces, and healthcare institutions. Weak immunity, together with the malnutrition, is also a risk factor since the immune system cannot protect the body from the TB bacteria. Community campaign plays an important role in the management and mitigation of some of the communicable and infectious diseases. Right information to be delivered to every household is the key for this endeavor. It is suggested to come up with a different information education campaign or IEC for this matter. This includes printed materials such as comics for reading, calendar for guiding the individual, and the video clips. Before the conception of IEC, it is a challenge for us to know what the appropriate information are applicable for them. We must remember that planning is very essential to derive this IEC. It should be fitted according to the community and household setting so that they can easily grasp the information we will provide. Visiting the place is the first step. This must be done in the coordination with the community leaders and local government units. Identifying the socioeconomic determinants of the community behavior towards children living with tuberculosis or CLTB is recommended. The purpose of this is to match our perception of the disease to the development of this IEC. On our case, the narratives were collected during the interview of the research team. Our respondents were caregivers and mothers of the children living with tuberculosis. Narratives on their disease knowledge were collected. This includes health-seeking behavior of the caregivers to control the dreadful disease. These were done through face-to-face interviews and focus group discussions such as FGD. Our study sites were in the urban and informal community settlers from Baseco Compound in Manila, Payatas in Quezon City, and Bagong Silang in Caloocan City. Basically, we identified the misconceptions on the knowledge of respondents towards tuberculosis. This includes the localized concepts of sakit sa baga. This is the basis of their understanding on the symptoms and transmission of tuberculosis. They stated that the disease is a normal cough and must not considered a severe form. They acknowledged the idea of primary complex, which is the term coined in the pediatric tuberculosis. They often regarded the primary complex as mild disease. On the other hand, TB is the adult form of the disease. From this local context, there will be a problem in the management of disease, such as the medication intake, management, routine testing, and diagnosis. Caregivers must perceive the lesser risk of pediatric tuberculosis as compared to the adult TB. Delay in the diagnosis and treatment were the possible risk of this misinformation. The caregiver were often surprised to the TB diagnosis due to the asymptomatic status of their children. It is only when the disease progresses when they decided to seek the medical attention for their children. Manifestation of markers such as vomiting and coughing of blood are the basis in allowing their children for the treatment. Environmental condition from the solid waste materials and its smokes often associated with the source of the TB, in which the children are more vulnerable. This belief is the reason by most of the respondents. Although there is a scientific evidence that the smoke from the materials can impair the respiratory function, and this can lead to the development of TB. They also believe that dry sweat and changes of the season can also lead to TB. The respondents acknowledged the contagion brought by TB, especially in a certain enclosed area in the households. Caregivers themselves are the ones who have TB, yet they continue to take care of their children as the other household members are engaged in other economic activities. Another concept of the TB is that the disease is hereditary, as CLTB usually belong to a family that has a history of TB. The assumption of the caregivers is that the disease is based on inheritance. This belief disregards the practice of infection precaution as it permits close contact to the active TB patient. From their perspectives, these are the indicators of having TB to their children living with the disease, such as nakahiga lang or just lying down, inuubo or coughing, masakit ang dibdib or chest pain, and nahihirapang huminga or difficulty of breathing. Physical inactivities relates them of having the disease. This includes as hindi nakakapaglaro or unable to play, nasa loob lamang ng bahay or just inside the house, and malungkot or sad. Health workers and community workers were trained to educate about the TB, encourage them to undergo laboratory tests, and follow up patients' medication adherence and compliance. Although it is true that this happened, not all areas are covered by such. Despite the existence of the community health centers, nearly all informants claimed that there was no signs of health education about TB within their area of jurisdictions. TB dots clinic were available. If there is, it only happens in health centers. And when TB patients will start the course of their treatment, hesitation among children to seek treatment due to the difficulty of confirming the disease. There were misinterpretations of the TB medications. There are CLTB who stopped their medication intake. Health workers were not able to follow them up. Instead of finishing the standard treatment, their failure to take medicine may lead to their drug resistance. There were also documented wrong prescription given to the children. They were prescribed with anti-TB drugs even if their laboratory results were negative. Most of them perceive that TB is caused by vices such as smoking and alcohol consumption. This is to promote the local information awareness strategy on TB through the Information Education Campaign or the IEC. The primary objective is to visit the houses of these vulnerable communities, inform them about TB, symptoms, diagnosis, and treatment. This can be done through interdisciplinary mentoring and exploring the rationale on its gap despite of the free medication provided by the government sectors. Results generated from the study will give us the characteristics and patterns of information usage among the caregivers of the pediatric TB. Moreover, the study may also provide a valuable information to policymakers and organizations responsible for the TB management. This aims to establish appropriate information drive to the caregivers of the pediatric TB will aid in the TB management. This was done through a child center and a community-based information education campaign or IEC material on lowering risk and vulnerability to TB. Specifically to formulate this IEC through the different strategies like the printed materials, comics and calendar, and even video presentation. We have 3 proposed IEC materials were developed. First is we have the calendar, second is the comic, and the third is we have the video clip. Calendar was developed in such a way that there is a brief and concise information about pediatric tuberculosis. The following information or quick facts were included: the definition of the pediatric TB, causes, exposure, medication and treatment, symptoms, diagnostics, and preventive measures. Provisions on daily records of the medication intake was already incorporated in the calendar to guide the caregivers and the mothers of the children living with TB. Daily medication records involved in the fixed dose combination for the treatment of the pediatric TB such as isoniazid, rifampicin, pyrazinamide, and ethambutol. Remarks such as the patakda was also included to document the side effects, adverse drug events such as nausea and vomiting, and other pertinent information that might affect the daily medication intake. Comic storyboard was based on the common knowledge, events, and situations of the 3 informal settlements. Prior to this development and conception, caregivers' insights on TB were collected through a one-on-one interviews and the focus group discussion. This is the story of the mother living with TB. The mother passed on the disease to her child, who also shows the manifestation of symptoms such as cough, night sweat, easy fatigability, and lethargy. Mother decided to bring her child to the doctor. The doctor confirmed the diagnosis of the pediatric tuberculosis through skin test chest x-ray, and sputum test. Preventive measures and medications intake were highlighted in the story. The story tells the caregivers on the benefits of the medication and treatment. Both the mother and her child were able to manage the TB progression. In video presentation, the story is the same as the comic. Narration with subtitle was included to better understand its content. These are the perceived uses of IEC among the caregivers and children living with TB. First, majority of the caregiver gained knowledge on TB after viewing the IEC materials. Based on the findings, majority of the respondents stated on the increased and renewed knowledge on tuberculosis. It was noted that some of the mothers still didn't realize that TB can be resumed. Addressing promptly the symptoms and some preventive measures like covering of the mouth during cough or sneeze, temporary isolation, and access to highly nutritious foods were highlighted. The sense of responsibility was seen in one respondent by not transmitting the disease to their children. The second one is the efficiency of the IEC materials. Majority of the respondents realized the importance of calendar to guide them on the daily medication intake. This was followed by comic where the situation can be emphasized as a good reading materials. Due to inaccessibility of video, caregivers prepared comics over the video presentation. Some respondents were willing to share the information and content of these IEC materials. The third one is the strength of the IEC material. Respondents realized the previous symptoms and treatment to other children as depicted, especially in the printed materials such as comic and calendar. The caregivers easily understood the content of comic and video simultaneously. The calendar conveys the quick fact to the caregivers and serve as a red flag information if the symptom still persists. The fourth one is the issues on the IEC material. Caregivers do not have any issues on the IEC materials. They treated the three materials are of the equal importance. They agreed on the informative format portrayed by the IEC materials. One caregiver suggested to provide a cup to exactly measure the medication syrups to their children. These are the three possible approaches to the IEC, namely individual or interpersonal approach. Second one is the group approach, and the third one is the mass approach. Each communication methods have its own advantage. Individual approach is the best suited approach because of the personal communication. The last two approaches allow free flow of information, suggestion, and clarification by their respondents. Mass approach, such as the video and visuals in social media, has disadvantage because of one-way communication in which subject matters cannot be clarified. The formulated IEC offers communication strategies for TB control. For its interactive communication, such as strategies for TB control, for its interactive communications, such as engagement to support their respective communities on the dissemination of information. Group meeting is important to relate all socio-economic aspects of TB control to ensure its contextual relevance. Stigma on pediatric TB is still present, as exemplified by their coinage such as sakit sa baga and hika or asthma to mask the real diagnosis of their children. Misinterpretation on medication intake was initially documented due to the limited source of information that must be conveyed by the healthcare volunteers. This includes appropriate time of administration. Some of the respondents didn't use appropriate dosage form. The tablet was given to the pediatric patient instead of syrup. This is the result of the misinformation due to the lapses of communication from healthcare volunteers. Based on the narratives, the caregivers accepted the importance of IEC materials due to the usefulness and ease of usage, such as the facts from the calendar and situation from the comic and video clips. It was suggested that the majority of the caregivers were confident to use calendar as a tool and guide for the medication intake of their children. Knowledge on TB was enhanced through IEC materials according to the common narratives of the caregivers. Comics were prepared over the video due to the accessibility of its usage. Majority of the respondents recommended the materials to enhance the knowledge on their respected community. This pilot study determines already the acceptance of the selected respondents on the tuberculosis management through the printed materials. Before we end, let's have a short assessment. Question number 1. Which causes tuberculosis? A. Virus. B. Bacteria. C. Fungi. Or D. Protozoa? The answer, we have bacteria. Therefore, tuberculosis can be cured with the help of anti-tubercular drugs. Question number 2. This is a true or false question. Multiple drug-resistant TB or MDR-TB is a common problem in the eradication of TB in our country due to the wrong medication intake among the active TB patients. Is it true or false? The answer is true. Therefore, we need to conduct medication counseling to these patients to increase the awareness of the benefits of the anti-tubercular medications. Question number 3. What are the role of the healthcare workers in the dissemination of information on TB? Letter A. Coach the active TB patients in taking the right anti-TB medication. Letter B. Encourage them to do sputum test and chest x-ray. Letter C. Providing other information such as proper ventilation and isolation. Or letter D. All of the choices. The correct answer is letter D. All of the choices. For our last question, this is the recommended type of information education campaign material in the proper monitoring of the medication compliance by the children living with the tuberculosis. Letter A, video clip. Letter B, comic strip. Letter C, audio records. And letter D, calendar. The answer is letter D, calendar, because this contains a checklist of different anti-TB drugs and remarks per day for the caregivers to document. I would like to acknowledge the University of Santo Tomas Faculty of Pharmacy, the University of Santo Tomas Research Center for Social Sciences and Education, and my co-workers in the research team and colleagues. This is Assistant Professor Jay Azul from the Pharmaceutical Sciences Division of the National Research Council of the Philippines. Thank you very much and have a nice day.